Thank you. I yield myself such time as I may consume. Again, this is the third in a series of bills over the last 2 weeks that tries to roll back the protections that the federal government has put in place to try to stop the pandemic. Now, granted, the pandemic, we've had a lot of success. I mean, President Biden for the last 2 years in terms of promoting vaccines and testing and all kinds of public health protections. COVID is on the wane. The number of people dying, the number of people hospitalized, all that is on the wane. And he has said that he's planning on May 11th to lift the public health emergency. But all I have been saying, and all the Democrats have been saying for the last 2 weeks on all these bills is, let's go by the science. Let's be reasonable about this. Let's not assume that we can let foreign travelers in and not be vaccinated. Let's not assume that it's a good thing for public health workers not to be vaccinated. Let's not make a decision to end the public health emergency immediately. Let's leave it up to the agencies and the expertise, which, again, I believe are the best in the world. I'm not interested in what Russia does or Cuba does or some of these other countries that are mentioned, because we have the best experts in the world. And if anybody denies that, I'll prove it to them that we do. The bottom line is that as Democrats, we understand that the pandemic is on the wane, but we don't want to rush to make decisions or force decisions, if you will, on our public health experts that could be detrimental or make it difficult and tie their hands. One of the things that's in this bill, and there are going to be a series of amendments now to deal with this, is to say that not only is this vaccine mandate eliminated, but that the CDC can't even make any other types of mandates like that in the future. That is very dangerous to make that, to tie their hands. When we don't know exactly where COVID and the variants are going to be going in the next few months or the next few years. It's a mistake to do that. And so we'll hear about some of these amendments that I think that are really important. But the bottom line is, this is a bad bill. It continues this policy of basically eliminating the protections that we've been trying to put in place, that we've had in place, and that have helped us get beyond the COVID pandemic for the most part. So I would urge my colleagues, for the sake of science, for the sake of helping the people, for the sake of public health, to vote no on this legislation. And with that, I yield back.